Once again, good morning. My name is Charles Wilson, and I work for the Washtenaw County Health Department, where I supervise our Community Health Promotion Division. I'm very excited to welcome everyone to today's live stream. Today's topic will be the latest information on the COVID vaccine. Washtenaw County Medical Director, Dr. Juan Marquez, will be giving an update on the latest COVID vaccine news, and afterwards we'll answer any vaccine-related questions. But before I begin, I want to acknowledge and thank our, our fabulous team who helped make this live stream happen. Pastor George Waddles of Second Baptist Church in Ypsilanti, Pastor Harold Wimberly of Christian Law Fellowship, Karen Newman of Second Baptist Ypsilanti, and Washtenaw County Health Department staff members Beth Ann Hamilton and Adam Paviers, and Dr. Juan Marquez. Now, to give some background as to how this event came about, this past summer, Mrs. Newman, who partners with the health department on our COVID vaccine outreach efforts, approached us and suggested that we provide an opportunity for those in the faith community to get information about the vaccine and to get their questions answered. Now, today's agenda will include remarks from Karen Newman and Dr. Marquez, which will be followed by a Q&A. And then we'll wrap up. So now I'd like to turn it over to Karen Newman for her remarks.
Thank you, Charles. Good morning, everyone. I am excited for this COVID informational session today. This will give us an opportunity to hear about new COVID vaccination developments and to ask questions. As Charles stated, I volunteer as a vaccination ambassador with Washtenaw County Health Department. I volunteer because I strongly feel, I believe in the medicine. I truly believe that the only way out of this nightmare is for us to get the vaccination and practice social distancing. As a community, we need to stay well informed and pass accurate information along to others. We can make a difference by educating our family, friends, co-workers, neighbors, and church members. Thank you very much for this opportunity.
Thanks, Karen. And now I'd like to turn it over to Dr. Juan Marquez, Medical Director, Washtenaw County Health Department.
Thanks, Charles. Thanks, Karen. So I would echo Karen's points 100%, where I think that, we've had different phases in the pandemic where, at first, really the only tools we had at the very beginning, it's been a while, it feels forever, but, if you remember in March of 2020, really the only tools we had available were, wearing a mask and social distancing and, additional, other restrictions that we had in place. I think this vaccine is, so the technology for this vaccine, the research has been decades in making, but, sort of the process to actually go from sort of this use in other areas like cancer to vaccines is really nothing short of really a miraculous amount of work done by scientists across the world, really, to get us a very effective and safe vaccine. I think that it really adds a huge tool to our toolbox, and so it really is the way to end this pandemic, right? And so I am very happy to answer any questions that might come up regarding the safety, the efficacy of the any of the vaccines, of the boosters, of anything of that nature. So I think one of the things that there's a lot of things that are changing in terms of vaccines. There's some people are eligible, some people are not. It's now being extended to children. So I think one of the things that I'd like to just kind of make sure that we all have the same sort of background is really, sort of a little bit more just information about the vaccines. So we have 3 different vaccines at this time. One of them is fully approved. All that means is that it's gone to the necessary amount of length of data to be considered fully approved. But truthfully, there's so much data for all these vaccines that it's just a matter of time before they get approved, right? So there's two that are under emergency use authorization, which would be Moderna and J&J, and then one that is fully approved for particular age groups, 16 and over. But again, they've been used now in hundreds of millions of people and have shown to be quite safe. So there are, as I mentioned, 3 vaccines. 2 of them are Moderna and Pfizer. Our technology is called mRNA. This is a technology that I mentioned that has been around for probably about 20 years. And it's typically been used in cancer therapeutics, cancer treatments. But when the pandemic first occurred and there was the genetic code of the virus had been put together, the scientists who were working on this type of technology realized the potential for being able to be used in exactly this scenario, which is creating a vaccine to be used in a pandemic. And so they shifted their attention to this. And so both Pfizer and Moderna use this mRNA technology. I guess there's a few things. One is that, as I mentioned, they shifted their attention. There has been no shortcuts in safety for any of these. So all of these vaccines have gone a very, very rigorous approach to make sure that they were safe and that they worked well. There's different phases in vaccine development, phase 1, phase 2, phase 3, and they've all gone through the same rigorous trials that have been done for any other vaccines or any other medicine in the past. One of the questions that we get asked is, well, how did they make it so fast? Doesn't that mean they took shortcuts? And the answer is definitively no. So one of the things that happened was that although the trials were done sequentially as they normally do, what happens is that typically so once the medication or the vaccine is approved, it's only then that the companies start the manufacturing process to make this in big scale. Because of the nature of this pandemic, the government stepped in and assisted and basically said, listen, start the manufacturing in parallel with the actual clinical trials. And if the trials don't go well, we will pay for the cost of the manufacturing, right? So they basically provided a safety guard that allowed the companies developing the vaccines to be able to do it much faster without compromising the safety. And so I think that's a really important point to understand, that really was done very, very, very rapidly, but no shortcuts were taken. And we can see this really with the approval process now, where it's the same approval process that we've had for every other vaccine. It's deliberative. The advisory committees, which are independent from the governmental agencies, are the ones that provide input into the approval process. So I just wanted to, before I even talk about the vaccines, really talk about that process and the safety. So what I was going to mention initially is that there's two mRNA vaccines. It's Moderna and Pfizer. Moderna is a 2-shot series that's 28 days apart. Pfizer is a 2-shot series as well. That's 21 days apart. There's also Johnson & Johnson or Janssen vaccine that is a different technology. It's basically using a modified virus, sort of a cold virus actually, to deliver the signal to the body. That is a 1-shot series that's available. If you have, for younger kids from the ages of 12 to 18, at this point, the only available product is Pfizer, which is a 2-shot series we talked about. But for anybody over the age of 18, they have the choice of really any of those vaccines. So some of it just comes down to, so your preference. Do you want to have 1 shot, or do you want to get 2 shots for your primary series? Now, the other thing that's come out lately is really boosters. Now, you might wonder, well, why do I need it? If you're telling me that these vaccines are so effective and work so well and so safe, why do I need a booster? That's a really good question. So it should not take away from your confidence in the vaccines. We get boosters for other vaccines that are really actually effective. So for example, you think of, your tetanus shots, you have a primary series, but then you get a booster later on. And so the reason for these boosters is not to take anything away from the effectiveness of the vaccines. Rather, there's a couple things. One is that with such a high caseload around the country, so many cases, what other countries have found that have put in a booster is that it is a very effective tool for curbing the number of cases, right? So we basically boost everybody's immune system, and they found it's actually quite effective to bring down the numbers. So that would be one reason. So that's kind of one reason we put it in. The other reasons really is that, you know, we have different variants that are coming that we're seeing. So, you know, we've had this, you know, initial one, the wild type that we had another one that we initially called B117. It's now known as the alpha, right? But now we're dealing with a much more infectious one, which is called the Delta variant. And so, you know, one of the things is that the booster can really help be more effective against the Delta variant, to make sure that it's really giving us, an extra boost, if you will, to battle against this new sort of more contagious variant. In the future, if we have a different variant, we might need another booster, right? It's hard to know. It really, you know, we're doing it as we, you know, you know, everybody is valuing the science as we move forward. And, you know, if another variant comes out that's more infectious or is different, we may need another booster. But, you know, that's sort of in the future. For now, we know that, you know, the primary season is very effective, and this basically will prime your system even more against these variants. So I think that is, the last thing I'll say is just for children, we have a vaccine that's coming. The hope is that, again, after going through a very rigorous process in the clinical trial, that the FDA will review it, hopefully starting next week. The initial data has looked really good. It's looked very safe. It's looked very effective. So the hope is that the FDA will review it next week, and then hopefully very early in November, it will be available for children between the ages of 5 to 11. It will be a smaller dose, so about a third of the dose of our typical adult dose, and it will be in, you know, sort of different packaging, different coloring, so people can be sure that it's it's sort of very specific for children. So I think that's maybe I'll stop there and see if maybe start talking about some questions or see if there's anything else coming up.
Thank you, Dr. Marquez. We've gotten a few questions that have come in since the live stream started. In fact, we have two, and I'd like to start with those. The first question is, I'm told Washtenaw County Health Department is requiring school staff to get a negative PCR test, not just a rapid test, if they have any possible COVID symptoms, even just a headache. Is that true? And is this really a requirement versus a recommendation?
So that is a good question. So I will say that that the only requirements that we have currently in the county, just in terms of things that we would enforce, would be two things. One of them is isolation and quarantine guidelines for K through 12 environments, and then mask guidelines in those as well. Now, if somebody is having COVID-like symptoms, we recommend that they undergo a test. The gold standard test is really a PCR test, because it's so much more sensitive really than an antigen test. If somebody undergoes an antigen test, the clinical recommendation is really to undergo a PCR test to make sure that it's, somebody really is not having COVID and that we just didn't miss it with the rapid antigen. But again, these are sort of, I would say, clinical guidelines, clinical recommendations that we've had, not just for the school environment, but really for everybody. Whenever we have the same question, whether it's from school teachers or students or from the general community, it's the same recommendation that we would have, which is, antigen tests are great. They play a really important screening role. If you're having, COVID-like symptoms, our recommendation is that if that test is negative, to really undergo a PCR test.
Gotcha. Thank you. The second question, it reads, does the Washtenaw County Health Department support schools having a modified quarantine? Excuse me, let me start over. Does the Washtenaw County Health Department support schools having a modified quarantine option for unvaccinated close contacts? Which districts in the county are offering this option, and how does it work in those districts?
Yep. So the modified quarantine, so MDHS issued guidelines in early September that allowed for essentially modifications of the standard quarantine. So standard quarantine works that it's, the very standard quarantine is a 14-day quarantine that is based on the incubation period of the COVID-19 virus or SARS-CoV-2 virus. So the thought is that, after 14 days, if you have not had an infection, you're unlikely to really get to really exhibit symptoms, either mild symptoms or be asymptomatic, right? So that was modified to 10 days after after modeling done by the CDC that allowed for certain situations that the vast majority of cases are really within a week, 7 to 10 days. And so after 10 days, it's typically found that although there are some individuals that will develop symptoms or signs or symptoms after 10 days, really it is the vast majority of people that sort of will, that's a 7 to 10 day quarantine will be very effective. There's also additional ones that came through the CDC during those guidelines where there was a 7-day quarantine period that was also sort of allowable under these CDC guidelines based on modeling studies that showed that if you tested within essentially 5 to 7 days, you would capture, again, the vast majority of folks. Because even though the incubation period is about up to 14 days, most people essentially would be infected within 7 days. Now, across the state of Michigan, really we use a 14-day quarantine period until December, at which time these guidelines came out. And I think the vast majority of counties at that time shifted to allow a 10-day option just across the general population. Now, what we've seen is that in school settings, especially in school settings that have universal masking, as is all the schools in Washtenaw, that there is, and take other mitigation efforts, again, sort of like this layer approach, there's actually a decreased risk really in the school settings. So if you look at some of these larger studies, there's not a randomized controlled trials, but a group from a big group that is the ABC Collaborative. Sorry, his name was escaping me. Has looked at sort of secondary transmission within schools. Have found that really it's in these approaches where you take a layered approach, with including a fully masked environment. It typically is less than 1% secondary transmission. So understanding sort of all this, as well as the impact that quarantine has on students, the MDHS sort of proposed guidelines in early September that allowed for different modified quarantine depending on the school's capacity to be able to implement such capacity. So the standard quarantine is really home for 10 to 14 days. The modified is essentially one of two options. One is that they implement that 7-day CDC test, essentially discontinuation of quarantine after 7 days, which is part of the CDC guidelines. That has not been implemented across the state, and so they allowed for implementation within schools. The second one was essentially a test to stay program that other countries have done, as well as other states, where you test on a regular basis to allow the students to continue. Again, that is dependent on two things. One is people power to be able to do the tests, and also test supplies. So the county adopted both of these with a couple caveats. So the one is that understanding that daily testing for students would be quite onerous. The county allows, again, sort of in the quarantine and isolation orders, allows for testing 3 days a week, every other day, I should say, rather than every daily testing. This is based on some studies that were done that showed that testing at least 2 to 3 times a week is as effective in detecting asymptomatic illness as is daily testing. So in the local county orders, the modified quarantine is allowable with, again, 3 days of testing or testing after 7 days. It is but there's a big caveat, which is true not just for schools, but across every really county organization nationally, that there is a big shortage of people to do testing, and there's also a shortage of tests available, rapid antigen tests. So it's really it's allowable with the caveat that schools have to be able to implement it, and that we leave to each of the schools' decision to understand if they have the resources to do so. So it's a long-winded answer, but hopefully it's addressed the questions.
I have a question, Dr. Marquez. I had one Moderna shot 6 months ago. I am a cancer patient. Will Moderna be effective for me after so long of time between?
Yep, that's a great question. So the short answer is yes. The longer answer is that that there is no maximum interval between doses. So you get one dose, you can get the second dose anytime after a month later. There have been some studies that if you actually space it out a little bit, is actually more effective than, and this is again some preliminary studies that have not been vetted kind of through like the rigorous process we talked about. But yes, but the one thing I would advise is to talk to your oncologist so that you can make sure that it's timed, between any ongoing treatments, and that they sort of taken a look at your immune system to make sure it's responding appropriately, so that you can kind of get the most impact with that second dose. So again, there's no problem having it now. I would just check with your doctor to make sure that to check the timing to make sure you can get that second dose at the best time possible.
Thank you. So, Dr. Marquez, these next series of questions are related specifically to the booster. So, I think you covered some of these questions in your remarks, but just in case people joined a little late, it's the one question that I want to make sure that we answer is: can you get a booster if you got Moderna or Johnson & Johnson?
Yes. So that's a great question. And sorry, I think that in my opening remarks, I just kind of threw everything out and saw it stuck. So I think I can clarify things now. So at this time, the CDC, both the FDA and CDC have approved boosters for all vaccines, right? So there's a little bit of caveats for them. Okay, so let me just walk you through what the caveats are. Anybody that got J&J can get a booster 2 months after their initial dose, right? So if it's been 2 months and you've gotten J&J, you can get a booster. If you have gotten Pfizer or Moderna, you can also get a booster at 6 months, but not everybody is eligible for that booster. It's really focused on those who are essentially at greatest risk of severe disease or at greatest risk of exposure. So individuals who are eligible for the Pfizer or Moderna booster include people who are over the age of 65, include really anybody that has pre-existing conditions. So that would be things like diabetes, kidney disease, hypertension, heart disease, obesity. So it covers actually a big group of folks. So if you have underlying medical conditions that would make your possible COVID disease more a little bit worse, then you actually qualify as well. And anybody living in sort of an institutional setting who's 18 and over, that would be if for example, if you or a loved one lives in an assisted living facility, a nursing home, a group home, everybody there in that setting qualifies. And so the Pfizer boosters have been really available for almost a month now. The Moderna and J&J just started. So for example, here at the health department, because there's still steps we have to take to ensure that our internal process is smooth. We're not offering it today, but we'll start offering it on Tuesday in our Tuesday clinic. So the other thing is that for all of these, you can decide it's up to you what you want for your second or for your booster dose. So if you've gotten Moderna and you want to stick with Moderna, not a problem. If you've gotten J&J and you want to do a mRNA like Pfizer or Moderna, not a problem. So it really allows for a great deal of flexibility for folks to decide what booster they want.
So are booster shots free? And besides Washtenaw Health Department, where else can I get a booster shot?
Yep, great question. Boosters are 100% free. So one of the the U.S. government, the federal government has purchased vaccines for essentially everybody, right? So there should be no cost to you. You may be asked to present your insurance at places, but if they may bill for administration, but if they should not be billing you as an individual. So if they don't recoup it from the insurance, you should not be getting a bill at all for these. You can get it literally anywhere at this point. So it is unlike last January or March, where it was very limited. You can get it here at the health department. Certainly, you can get it at your local pharmacy, CVS, Rite Aid, Costco. I think Walgreens is also doing it. Myers. You can get it at your local, like provider. Typically, if you go to IHA or Michigan Medicine, they're certainly doing vaccinations there. And if you go to, for example, Packard, they'll also do it. So it really is very, very widely available. There is a website that you can look at. Let me just make sure I give you the right one. So vaccines.gov, that you basically can type in your address, and it'll give you the closest location to you. So I would just advise you to call ahead just to make sure they don't, they're not short of anything, but it's certainly available at many, many places.
Thanks. So this next question is a comment / question, Dr. Marquez. The rules and guidelines feel like they change all the time. What should I be doing now to prevent the spread of COVID-19?
Yep, so that's a great question. And I think that this would it's a really important question, right? Because so early in the pandemic, there were a lot of restrictions. There were a lot of rules and laws rules and executive orders, epidemic orders that told you what you can and couldn't do. So if you recall, there was an order that you couldn't gather between households. There was an order about putting on masks. And there's many of these. And now, many of those have been sort of removed. And so it kind of leaves us to figure out what to do. And so what we have now is a series of recommendations, right? And so I think that the most basic recommendations that I would offer anybody is really, whether you're vaccinated or not, if you are in an indoor space, I would recommend wearing a mask, right? It keeps, even if you're vaccinated, it keeps those around you safe in case you happen to have a very mild breakthrough case, right? It's not common, but it happens. So I would certainly recommend getting a mask, wearing a mask. I would certainly recommend social distancing whenever possible. And those are sort of like across the board, right? But this is the thing, right? We are now in a setting where, at least in the county, we have a lot of folks that are vaccinated, right? So it's a different time than we've had before. And so, I think some of this is actually a bit of understanding your personal risk and the risk of your family members, right? So what I mean by that is that not all settings are the same. And so, if you understand sort of what the settings that are highest risk, you can kind of understand, sort of what you might want to avoid if you yourself or others are at higher risk of COVID, whether you're vaccinated or not. So in another country, in Japan, they had a media campaign, which I thought was very clever and very effective, which is where does COVID actually spread? And they actually had the 4 C's, right? So COVID can spread in places that are crowded, to write these out all the time: crowded, closed, where there's close people, and when there's chanting, right? So the 4 C's are crowded, close, closed, and chanting. So if you think about that, right? So if you go to, as an example, a bar, right? A bar is crowded. Typically, there's not great ventilation, so it's closed. People are very close to each other, and there's chanting, right? Just loud talking, right? All of those are sort of ripe for COVID transmission. So, if you are a vaccinated, young, otherwise healthy person living by yourself, is that safe to go to? You can make that personal decision. I would still recommend, again, like I said, wearing a mask and trying to stay, socially distance. But that's sort of your sort of risk that you take into account. Now, if you go to for example, a family gathering that's outside in a barbecue, right? Is it crowded? Probably not. Is it closed? No. Are you close to each other? Yeah, probably. It's a family gathering. Are you chanting? Yeah, maybe not, but you're outside, right? So something like that really reduces the risk for yourself and people around you. So again, if you go with, a very young vaccinated group of folks into an area like this, it is a very low risk area. But, you can start thinking, well, if you go to a family gathering with maybe grandma or grandpa there, do you want to do this inside? Even if they're vaccinated, you might want to consider doing it outside, right? Or opening the windows, right? So these are all things to kind of consider about your personal risk. And those are the recommendations that, that I tell my family, that I tell my friends, is really sort of the thought process here. So, again, the kind of take home is things that you do outside are typically safer. When there's less people, it's typically safer. And then when there's better ventilation, it's typically safer. So those are all things that I would consider when you're kind of considering what to do. So, for example, I'll keep talking a little bit more. Halloween, right? You're outside, you're trick-or-treating, right? So if you think about this 4 C's, is it closed? No, you're outside, right? Are you close to folks? Maybe not, right? It kind of depends on, but are you chanting? Probably not, right? And is it really crowded? Typically not, right? So, you kind of start looking at those things. Think of Thanksgiving, right? Thanksgiving is, it's typically crowded, right? People are talking real loud around the turkey, whatnot. Is it close? Yeah. Is it closed? Probably. But, there's steps you can take to mitigate that risk. One, and I think these are conversations that I don't know that people are necessarily always comfortable having, but they're important. Is everybody who's going to go there vaccinated, right? That's really a good question, important to know. Is there an agreement to say, hey, yeah, I know we're vaccinated, but let's pick up some rapid antigen tests at the local pharmacy and test ourselves before we go, right? Those are all ways to really, it's a higher risk setting, but these are all ways to, the vaccine lowers that risk dramatically. And then doing steps like testing, also reduces your risk. In the next few months, the goal is that there's going to be more and more home antigen tests that are purchased. They're really approved by the FDA. And then hopefully there will be for those who, they're not free, but for those who are, have, some difficulties buying them, I think that there's a push to really do subsidized testing for this exact reason. So sorry, that's a long-winded answer, but hopefully that provides some context.
Thank you. So you kind of touched on the next question. When should somebody get tested for COVID-19?
Yep, that's a great question. So so there are guidelines in place, right? So if you've been vaccinated, the recommendation is that you should be tested. If you're vaccinated and exposed, you should be tested for COVID-19 3 to 5 days after your last exposure. Because even though vaccines are very effective, especially against severe disease, you can still have a breakthrough case, certainly. And so the recommendation is to wear a mask indoors in public setting and be tested 3 to 5 days after that. Now, if you're unvaccinated, so anytime you have symptoms, I think it's a reasonable it's a reasonable test to take, whether or not you're vaccinated. So it's really hard to distinguish between the flu, common cold, and especially like in kids and older, this RSV and COVID. And so, I think that many offices now are doing sort of these multiplex tests that they allow for testing of the flu, of strep, of COVID. But not all places do that. So, but I think there's more and more availability for COVID testing. I think, especially certainly if it's diagnostic, which means you're having symptoms. So I would say that anytime you have symptoms, it is certainly an appropriate test to do, whether or not you've been vaccinated. And kind of think about your personal risk factors again. If you've been in think of any of these 4 C's, right? So let's say you went to a crowded restaurant a week ago, right? That's a risky place. So maybe you start, having some cough or something out. It can certainly be a common cold. It can certainly be the flu, but it can also be COVID. And so of those tests, the sort of most readily available really at this point is really a COVID test. So, you kind of also understand if you've been in close contact to somebody or you've been in a situation where there just might be some exposure, that would also certainly warrant a test if you're having symptoms. Now, there's also a type of testing called screening testing, right? There's some rules in place that are going to be put through the White House plan for mandatory screening testing. But one thing you can also consider is even if you're not having symptoms, but you've been in either you work in a place that is has a lot of exposure, or you're going to or you've gone to somewhere where it's again crowded, closed, there's chanting, you can certainly get tested just to make sure after 4 to 5 days after that exposure to make sure that you don't have mild or asymptomatic disease, and that would be called screening testing. Now, the type of testing that we really haven't done before, honestly, and we haven't really been able to, is really doing testing when you're going to an event with others who are more vulnerable. I think that type of testing is going to become more and more common. And so that would be another sort of area, especially with the holidays. So if you're going to get in a family gathering, I would certainly think it's actually really reasonable, whether or not you're vaccinated or not, but especially if you're unvaccinated, to be tested before you go to these family gatherings.
Thank you. And so speaking of, you mentioned, Dr. Marquez, in your remarks, the flu. I have a couple of questions regarding the flu here. However, before we get to those 2 questions, I'd like to address this question about kids under 12. When will kids under 12 be able to get vaccinated? And will those vaccines be safe for kids? I think you touched on this, but I just want to make sure that we revisit it.
Yep. So the FDA, there's a process for approving essentially any vaccine. So the vaccine itself, like the actual product, is reviewed by an advisory committee to the FDA. It's called VRBPAC, and there's an advisory committee that will look at the data and determine, make an advisement to the FDA whether or not the clinical trial show it's safe and effective. The FDA will then take that under advisement and decide whether or not they want to approve the vaccine. So that's the actual approval. So that'd be an emergency use approval for the vaccine. The next step after that is once the advisory committee has reviewed the vaccine data, the FDA has approved the vaccine, is for the CDC to have their advisory group meet and provide guidance on how to use that vaccine. So sometimes it's not always 100% clear cut how you're supposed to use a vaccine. And so the ACIP, or the Advisory Committee on Immunization Practices, really provides a lot of guidance for clinicians and providers to figure out how to use those vaccines. Now, so it's a little bit of a process. The first step is going to be next week, the 26th of October, so in a few days, where the advisory committee is going to meet. They're going to meet and decide whether or not the data looks safe. There's already been some materials that have been released that has showed that it's effective and actually very safe. So it just got released, I think, late yesterday. But we'll have more information in the next few days once they meet. But the preliminary data really shows that it's very safe for kids, including although the trial was smaller than we've seen sort of these real world settings, but there were no cases of something called myocarditis or pericarditis. So the data is looking very promising. The next step after that is that the ACIP and CDC, ACIP will meet and they'll provide guidelines. They'll also review the safety data. That is expected to be, I think, the first or second of November, but it's very like early in November. As soon as they meet and they give the okay, then it can then be implemented in. You can start actually vaccinating here in the clinics. But that takes a few days to roll out, right? There's already planning in place for this new product, but we have to wait for the new product to come. It's a different cap, different sort of administration. So there's a little bit internal processes everywhere that they have to work through to be able to vaccinate. So the thought is really that by hopefully the end of the first week of November or very early in the second week, that it's approved and children can start being vaccinated in the 5 to 11-year-old. In terms of the safety, that's a great question, and I think that again the early data, or not the early I should say, but the data that's been put out already shows that it has a very safe profile comparable to those of sort of like the older children. But certainly we'll have more information when they meet and kind of debate this early next week.
All right. Dr. Marquez, we're getting questions via text, Facebook, email. So I'm just kind of reading them as both Karen and I are reading them as we get them. This next question has to do with the WCHD or the health department and our vaccine protocol. When the vaccine becomes available for kids, will we as a health department be vaccinating kids or those under age 12 or 5 to 11, I should say?
Yeah. So certainly we will be having clinics 4 days a week, 4 to 5 days a week here, where it's walk-in clinics. You can bring in your little one and get them vaccinated. Absolutely. We'll also be partnering with schools to have vaccine clinics at the schools. And then we're also putting in the state of Michigan has had contracts with organizations that will also do vaccines. And so we are submitting requests to be able to do more outreach events to help with vaccination. So yes, it may take a few days, if we hear back on, let me see what day luckily I'm on my computer so I can kind of see the dates. So let's assume that we kind of hear back, early in the week, the first or the second. It takes us a few days to kind of get our internal processes clear. So maybe by the end of the week, that week or early next week. So it won't be the same day as the approval, but it'll be very, very close afterwards. And we'll certainly have a press release, announcements. I think Beth Ann and Susan are really great about sort of announcing everything through various channels. And so we'll be sure to have everybody know when we start doing children.
Great.
Thank you. So I know Charles spoke a little bit about the flu shot. And so let's switch over there for a second. So why should I get a flu shot?
It's a great question. So I think rightfully so, have focused on COVID this past pandemic. But every year, with the exception of last year, but every single year we have anywhere from moderate to severe flu seasons, right? Every year we have tens of thousands of people that die from the flu. We have hundreds of thousands of hospitalizations from the flu, right? Even though we think it's just a common flu, it's actually it can be very severe for those who are, have the same risk factors as COVID, those who are older, those who are younger, those who have underlying comorbidities. So on a personal level, getting a flu vaccine is super important because it protects you individually. I think there's sometimes where, there's thoughts where, it doesn't work at all. I still got the flu. It's possible. There's 4 strains that go into a flu vaccine. And so, it may not be very effective against one, but it could be super effective against others, right? And so even if it doesn't protect you from getting like a mild flu, it can still protect you from getting actually really sick and going to the hospital. So from an individual level, it's super important for you to protect yourself and your loved ones. Now from like a community level, it's super, super important as well. The reason is that, as I mentioned, every year basically hospitals are really, really stretched very thin because of flu season, actually. And so, they're running at almost close to capacity every year. And so the concern is that this year we have COVID cases going up, and we might have a bad flu season. And the combination of those, as well as sort of, catching up, hospitals trying to catch up on cases that they've had, just hospitalized cases over the past year that maybe didn't get appropriate care at the right time. The concern is that between all of those, we're going to have a hospital system that's over capacity. And so, it doesn't just affect, sometimes people say like, oh, you know what, I'm not gonna get the flu, I'm not gonna get COVID, so I should be fine. But the problem and the reality is that let's say a hospital is at near capacity, and you or a loved one, because of COVID and flu, and you or a loved one have a heart attack, right? If that hospital may not be able to take you, and so they have to redirect you to somewhere else to get care. That's already happening in certain parts of Michigan, actually, where someone who is not getting COVID care or flu care, but they can't get into the hospital. There's elective procedures that are being delayed right now. All of it because our hospitals are really running at near capacity. So as a community, it is super important for us to get vaccinated against the flu to help our hospitals out so that they can care for us when something non-flu, non-COVID happens. So because I think the last thing that any of us want is, to have a car accident, have to say, well, our two hospitals in the county can't care for us. We got to go, an hour away to, for a hospital that's with a bed open. I don't think anybody wants that. And so one of the ways that we can, help prevent that is really by, getting a flu shot. In addition to things that we already talked about, wearing a mask, social distancing, because believe it or not, it works for COVID. It works even better for the flu, right? So one of the reasons we had no flu this year, really, we had no flu activity last year, was because of the social distancing and the mask wearing. So, those things aren't just COVID related. They really do help protect us from flu.
Thank you. So we have a question regarding the flu. Another question, can I get a flu shot at the same time as my COVID-19 vaccine? Is there a waiting period, or is anything else I need to know to consider?
Nope. So there's no waiting period. There was a consideration for that before, but I think the data has shown that it's safe to get vaccines the same day or within a week or two. So there's no waiting period. The only consideration I would give is that you should give it in 2 different arms. I'm not sure if those have had a vaccine, a COVID vaccine. It can be pretty painful in your arm, right? I mean, not the worst, but your arm's a little bit sore. And so you imagine, a flu shot's also kind of get you a little sore. So you want to, I would advise to get in 2 different arms so that, you're not doubly sore in one. But really there's, you can get the same visit, you can get it the next week. It's not a problem at all.
Thank you. So as we're heading down the home stretch here, as far as the questions are concerned, Dr. Marquez, I think that this is an overarching question that I think we all have to consider, given that the holidays are coming up. Do you have any tips for talking with friends or family who aren't vaccinated? I want them to be safe, but it can be a hard conversation.
Yeah, I mean, I think there's many reasons somebody is not vaccinated, right? And so I think the conversation really has to understand the context of that, and really address the sort of the underlying reason or the cause, right? If somebody, for example, someone's like, what, I just haven't been able to because of work, then that's a different reason than somebody who really is, for one reason or another, very mistrustful of this vaccine or other vaccines. And I think they have different conversations. So, something that's, maybe something that can be solved like very quickly, maybe, if they don't, for example, if somebody doesn't have a ride, hey, I can give you a ride, right? That's like, I think, an easy solution. For those that are really more of a sort of a deeper sort of rooted mistrust in vaccines, I certainly think that if it's appropriate, if you have the type of relationship with them, to talk a little bit, hopefully what we've talked about provides a little bit more context that, these are safe. They've been vetted, not just, currently, but really in the last decades, especially the mRNAs. And so, hopefully that provides a little bit of context or of information to kind of help with that. The other is really the reality of like what that means for your interaction with your friend or family, right? If you have somebody who is not vaccinated, do you ask them, say, I know you're not vaccinated, but could you get tested before you come to our family gathering, right? Again, it kind of depends on your type of relationship with them, but those are also things to sort of, so we call it, sort of risk mitigation or harm reduction, right? So how do we reduce the harm to others by, taking different approaches, right? So, if you have the type of relationship that allows for that, then I think that would be appropriate. There's also, again, if you know that there's a significant portion of your family who is not going to be vaccinated and wants to come to the holidays, well, how do you make it safer for everybody? Again, testing is one way, but maybe there's, reluctance to do that as well. So how do you set it up in a way that's safe for everybody? Can you, again, ventilation is super important, right? So can you, I know it's going to be cold, but can you, open at least some windows and put some space heaters, right? You can get a fan to blow in air from the outside and put space heaters around. Can you do it outside? Is there a big venue you could choose where, you normally wouldn't? So I think those are all sort of considerations that, even if the conversations aren't going to be necessarily very fruitful, it does reduce the risk to others.
Okay, thank you. We have a question from a new mother. Are the vaccines safe for people who are breastfeeding or even people who are pregnant?
Yep. So that is a great question. So yes, again, I give a short answer, a long answer. The answer is that yes, they're very safe. The longer answer is that when we first started rolling out the vaccines, this is now 8 months ago, we had a small set of information showing us that one, from a mechanism, there's no risk to pregnancies or sort of lactating moms, and then we had a small number of people who were actually became pregnant during the trials that showed that it was very safe. Now, after doing hundreds of millions of vaccines with a large data set of pregnant moms or lactating moms, I think that the overwhelming answer is actually yes, it's very safe. And so I would encourage anybody who is pregnant or lactating, who is unvaccinated, to be vaccinated. Young women are generally at low risk for COVID, but pregnant young women are actually at much greater risk than their non-pregnant counterparts. And so it actually becomes sort of the risk benefit of vaccines for this particular population of pregnant women is actually really important, right? The benefit's really high and the risk is really low. I could not have been this confident, 9 months ago. The answer that we gave 9 months ago is that, it is safe as far as we know, but we'd recommend it, sort of considering the risk of their jobs at the time of exposure. At this time, I think the overwhelming answer is it's very safe, and I feel comfortable. Sort of as a strong recommendation for pregnant and lactating mothers who are vaccinated to get vaccinated.
So we've got a couple of more questions, Dr. Marquez. I heard the Pfizer vaccine got full FDA approval. What does that mean?
Yep. So when it comes to these vaccines, I will be honest, it's more of a label than anything else. So what fully approved means is that it has essentially 6 months of clinical trial data rather than 3 months of clinical trial data, right? And it basically allows for this to be fully, essentially approved. Before that, it's an emergency use authorization. There is no magic number that happens between month 5 and month 6, right? We don't have, other than maybe some of the flu products, we have nothing, no medication, no vaccine, nothing that has been as tested as this, right? We have 160 million people now who have been vaccinated with one of the products, right? We know it's safe. We know it works. And so it, the emergency use authorization versus, emergency approval is really just a label. And it really does not change the efficacy or safety of them. So it really just has to do with how much length of data has been collected, and then has it been submitted to the FDA and appropriate, and sort of that process has it begun. FDA, Pfizer began a few months before, or a month before Moderna, so they got their approval just because they have a month more of data. But I think that everybody who's in public health, whoever's in medicine, feels that it is sort of overwhelmingly safe.
All right. So, Dr. Marquez, there's a question here. It's another school-specific question, and it seems to have several questions. So I'm going to try to do my best to read it and break it down so that you can answer it. Why have we given the option of a test and a stay after a positive case at school? My serious concern about this is the use of antigen tests that can sometimes give false negatives. And I think you talked a little bit about that. So I guess really the overall overarching question here is, why have we given the option of a test and a test and stay after a positive case at school?
Yep, I think that hopefully I've already answered that before, where really in school transmission is actually quite low, especially in a fully masked environment. And the use of a single rapid antigen test, I would agree, the sensitivity is not great. When you do repeated antigen testing over the course of 7 to 14 days, you see sensitivity up to upwards of 90%, 91%. So I think that the combination of doing sort of low in-school transmission, as well as sort of the increased sensitivity by serial testing, make it a safe option in the schools that have implemented it. There's really been, the in-school transmission of these antigen, of sort of the close contacts, has been overwhelmingly very low. And so I think it actually is a safe option. In a case of an outbreak, where we've seen an outbreak, that may be areas where it's not, test to stay is not allowed, or there's sort of a modified version of it. Maybe you do more frequent testing, right? But I think that as a strategy has shown to be quite safe.
All right. And this is the last question. I think it's a simple one. So I'll go ahead and read it. Dr. Marquez, where can I get a flu shot?
So the flu shot you can get essentially the same place. Any retail pharmacy will have a flu shot. Your primary care doctor, if you have one, will have a flu shot. If you go to any other clinics, they'll have one. FQHCs like Packard will have one. Here at the health department, we also have some, we don't have them at our outreach clinics, but if you walk in, you can certainly qualify for a flu shot. So it is pretty widely available. Honestly, I got mine, because it was a weekend, and I just got mine at CVS because it just, I made an appointment, and, 1 p.m. and I showed up and it worked well. So really, I think anywhere that's more convenient for you, you can get it. Many times retail pharmacy is actually very convenient.
All right. Well, that's going to wrap up our live stream for this morning. We'd like to thank everyone for attending this live stream. And we're especially grateful to partner with Christian Law Fellowship and Second Baptist Church to bring you this event today. So thank you especially to Mrs. Karen Newman, Pastor George Waddles, and Pastor Harold Wimberly for their hard work and dedication to sharing important COVID-19 information in our community. And remember, you can view the live stream recording on our website at washtenaw.org/COVID-19, as well as all things COVID related. And please enjoy the rest of your weekend.